Depression is a very common mental disorder and roughly 270 million people worldwide suffer from it, while the dark figure is said to be even higher. And I'm pretty sure everybody had or will have a period of mild to moderate depression once in life. It is common amongst all ages, while the amount of women falling into a depression is slightly higher than in men. So depression definitely has some impact on your life. And especially in Western countries, depression is often treated with drugs. But how exactly do they function and what are the possible side effects? Let's dig deeper into that after the intro.
5, 4, 3, 2, 1. Oh, this you crazy mother.
Alright, I won't talk about depression itself and its symptoms, that will be stuff for another video, so don't forget to subscribe. But what you need to know right now is that clinicians subdivide depression into more or less 3 stages. Mild, where depression has a small impact on your life, moderate, where depression has already a significant influence, and severe, where normal life and normal functioning is no longer possible. But usually only the last 2 ones are treated with antidepressants. But before we can talk about how antidepressants work in our body, we must understand the principles of how our nervous system functions, because that's exactly where the medication works. Our brain is the most complex organ in our body. It consists out of 80 billion nerve cells, and one single neuron is connected with an average of 1000 other ones via so-called synapses. But depending on the cell type, this can be even more. It regulates literally everything, from movement to heartbeat to temperature regulation. And it also controls your emotions, inter alia, your mood. Especially your limbic system, which is located deep within the brain, regulates the way you feel. And it comprises structures such as the hypothalamus, the hippocampus, the amygdala, and the prefrontal cortex. And the signals are transmitted via electric impulses. And usually this is all in a balance. How does this exactly function? On this picture you can see 2 nerve cells or neurons. The signal is transmitted from neuron 1 to neuron 2. And between the both neurons is a so-called synaptic cleft. In neuron 1 or the presynaptic neuron, there are vesicles containing so-called neurotransmitters. When an electric signal comes, the vesicle moves towards the cleft. There they fuse with the membrane, open up, and the neurotransmitters are released. They travel through the cleft, bind to specific receptors on the postsynaptic neuron where the signal is transduced. Of course, the biochemistry behind it is much more complicated, but for now this should be enough. The important neurotransmitters in the brain implicated in depression are the monoamines dopamine, norepinephrine or noradrenaline, and 5-hydroxytryptamine, also known as serotonin. But of course others exist as well. Until now it's not 100% clear what causes long-term depression, but one well-accepted theory, or actually fact, says that it's because of a lack or non-functioning of the monoamines. By the way, serotonin has an impact on your sleep quality as well, as it's a precursor of melatonin. I made another video about how to improve sleep quality and quantity naturally in another video. I left the link in the description below. The most prescribed type of antidepressants are the selective serotonin reuptake inhibitors, or short SSRIs. Let's have a closer look on how they function. You remember the neurotransmitter traveling through the cleft and binding to a receptor, as already mentioned. In a depression, we lack serotonin or another monoamine, so the serotonin receptors on the postsynaptic neuron are bound insufficiently. Normally, serotonin would travel back and be reuptaken by the serotonin transporters on the presynaptic side, and this reduces the serotonin concentration in the cleft. And what antidepressants do is, they bind to these receptors, inactivate them, and this leads to an increased concentration in the cleft. So the receptors are bound again and the signal is normally transduced. Keep in mind, these drugs do not produce any serotonin They just use it more effectively. Usually this functions for most of the people, but there are cases where it does not. For example, if you have fewer serotonin transporters, or if these transporters are not fully functioning, or serotonin is broken down before it even reaches the receptor. And it can also be that you simply lack B and D vitamins or omega-3 fatty acids or L-tryptophan, which is a serotonin precursor. Of course, if you also experience severe side effects, you might need to change your medication. But especially the SSRIs have no or only minor side effects because they are just very specific and selective for serotonin transporters. There are other ways to increase the neurotransmitter concentration in the cleft, taking other monoamides into consideration. Norepinephrine reuptake inhibitors can be used as therapy as well, in so-called SNRIs, standing for selective serotonin and norepinephrine reuptake inhibitors, additionally blocking the norepinephrine transporters. And there are of course some other variations, like for example the SARIs or the NASSAS. There are also other ways, using for example monoamine oxidase inhibitors, which prevent the breakdown of the neurotransmitters via blocking the monoamine oxidase enzymes. And these drugs are also used for Parkinson's disease and post-traumatic stress disorder. But take care, these are much more dangerous and have much more side effects and usually only used when the other ones fail. Possible side effects can be sweating, nervousness, dizziness, headache, and so on. And they differ a lot from person to person. Lastly, there is an older group of antidepressants used in the early 50s called tricyclic antidepressants, or short TCAs. They actually work similar like SNRIs, but they also block sodium and calcium channels and also other receptors as well, what makes them unspecific and causes not only more side effects but also more severe ones. Alright guys, depression is a serious topic, and during the last decades we learned more and more about it and how to treat it. And what's very important for me to say is that I'm absolutely not a fan of taking medication when it is not absolutely needed. Keep in mind that it's completely normal that we feel bad sometimes and that we have from time to time our mood swings. But that's definitely not a reason to take these medications. Plus, they won't do anything unless you take them regularly, and if you're healthy, they won't even function. Alright guys, thanks a lot for watching. I would highly appreciate if you would subscribe to my channel and support education on YouTube. Stay healthy and see you next time.